Yesterday, we learned how to recognize if someone is having a stroke. But how do doctors treat a stroke patient? WTVY's Lisa Sacaccio shares a cutting-edge procedure not offered within 100 miles of Dothan.
We're doing a coil embolization.
Since November of 2016, the Southeast Alabama Medical Center has treated more than 150 stroke patients in their stroke program. With the help of Wiregrass Life Flight, the hospital has saved the lives of people from Alabama, Florida, Georgia, and Mississippi.
As much as 30–40% of the country still don't have anybody that does this kind of work.
SAMC does a minimally invasive procedure known as neuroendovascular surgery to treat blood clots and aneurysms in the brain.
All done through small little incisions with a needle where everything's threaded up through wires and catheters all the way up through the vessels in the leg or the arm, all the way up into the head and neck to work in the brain. Pop it open like you would pop open an umbrella in the rain.
The procedure can be as quick as 5 minutes or take several hours based on the severity. Regardless of operation time, the patient leaves with only a Band-Aid on their leg from the IV site. So you have possibly a huge clot, you do this, and then they leave with a Band-Aid.
Correct. Before 1995 or 1996, we literally had nothing to offer stroke victims. So, we would just simply diagnose them, leave them in an ICU with disability. After 1996, we had this IV medication called Activase that we would give patients.
Activase, also known as TPA, dissolves blood clots, but it's not always 100% effective. That's when the doctors here at SAMC suit up in this outfit that I have here. It's heavy and made of lead, weighing anywhere between 40 and 65 pounds. It helps protect the doctors from radiation as they operate on the stroke patient. Sometimes the procedure is done while patients are awake.
With some mild sedation, and very often they'll actually get better while you're working on them. And it's very immediate and it's quite gratifying clinically because you see them literally get better in front of you.
Surgery has more than a 90% overall success rate. In Dothan, I'm Lisa Sacaccio, WTVY News 4, your hometown news leader. SAMC is looking to extend their stroke network. That way their neurosurgery department can give guidance via video chat to other hospitals who are new to doing neuroendovascular surgeries.
All right, behind the scenes you went, had a fun time.
Yes.
The doctor seemed thrilled to really break it down for you, but how was the experience?
Experience was nothing short of breathtaking. I will say I feel like I was more nervous than the doctors because they had a very cool, calm, and collective kind of vibe going. And I mean, I did take some tokens with me. I'm pretty sure you're supposed to throw these out, but I did take them, the mask and the net. But no, when I was in there too, as I mentioned, the procedure, it's with either a blood clot or an aneurysm. So the one that I witnessed yesterday was an aneurysm. That's the bulge in the vein and the coiling of the wires. But if it was a blood clot, then it would have been like the umbrella scenario that Dr. Whapham mentioned.
Okay, so since we mentioned that this is not offered within 100 miles of Dothan, about how many procedures do they do?
They told me that they can do anywhere from 1, but the most they had was 8 a day, and that was actually, well, 7 or 8 a day, I'm trying to remember, but 7 or 8, and it was on Easter Sunday. And what's interesting, and this actually happened yesterday while I was in there, as they're operating on someone, they can get a call simultaneously from somewhere else saying like, hey, we have a stroke patient, a possible stroke patient. Can they come in? And this was about an hour within that surgery, they got the call, and then when that surgery was over, that person who they got the call from was flown in via the Wiregrass Life Flight.
Good deal. Thank you, Lisa. Good stuff. Well, there